Hi, my name is Dr. Gary Circosta. Today we're going to talk a little bit about Invisalign orthodontics. Invisalign was developed as an alternative to traditional orthodontics, which, as we all know, is braces with bands, brackets, and wires. There are several features which make Invisalign very appealing to patients. It is specifically designed for adults and late teens who normally don't like the idea of braces. Invisalign is a series of invisible aligners. This is actually an aligner which is worn over the teeth to straighten teeth. It can correct malocclusions of crowding, too much spacing, too deep a bite, not a deep enough bite, or a midline shift where your upper and lower jaws don't line up. The advantages of Invisalign over traditional orthodontics is that it's removable. You take it out when you're eating, when you're brushing and flossing. In this way, you don't have to change your dietary habits at all. You can eat whatever you like, and you can also keep your teeth cleaner and your gums healthier than you can with traditional orthodontics. We would like to look at some cases in detail that we have actually completed. This is a case of severe crowding. As you can see, the case is analyzed on a software program that generates the aligners, and this is the end result. You can see how the teeth move in a series of steps to completion. Just look at the upper teeth. You can see how crowded they were. This tooth was completely out of position. And through a series of aligners, each aligner worn for 2 weeks at a time, we can accomplish a nice aesthetic result. This is a case now of too much spacing. Our previous case was too much crowding. This patient obviously has way too much spacing. The aligners slowly move the teeth together and pull them down to establish the bite relationship that we want. We can look at it from a different view as we analyze this. You can see how everything comes together. She's going to chew better, she certainly looks better, and she's certainly much less self-conscious about her smile. This is just her upper teeth before we started. Everything's closed and rounded out. Okay, one last case that looks like a case of too much space, but it's actually too much crowding because he has one tooth completely blocked out here. And you can see how the aligners slowly move things into position and give him a perfect smile. You can see how far this one tooth was pushed out and the other one was literally directly behind his front tooth. And everything was pulled nicely into place in just over a year's time. This is what the upper looked like. And this is what he ended up as. The lower was not as severe, but we straightened him out to match the upper. So Invisalign basically has the ability to correct any malocclusion that the patient may have, be it spacing, crowding, deep bite, open bite, misaligned teeth. It can all be done with the aligners.